welcome everybody. I'm Justin Rogers and I'm the CEO at the Martin James Foundation. And the foundation was set up by our founders, Jim and Ayab Coburn, as you all know on the call here, to look at this issue around institutional care. So the foundation at the centre of our organisation is looking at this move to reform alternative care and promote family-based care and children's rights to a family. So I'm really proud to be the CEO of that foundation with that mission ahead of us and that aim that we've got to work with partner organisations and programmes to develop family-based care in some low middle income countries around the world as well. So at MJF we're working from Madagascar through to Indonesia and Thailand on a range of different projects supporting people that are working on that issue on a daily basis. But today it's really great, we're the foundation is part of this wider network, and it's really great today to have a kind of cross-section of colleagues, of social workers that are working for the different services and organisations that are part of this network. So it's really apt and relevant for this theme of Ubuntu for World Social Work Day. So we're going to be looking at that as in our conversations, but also having that focus today on our discussions around the impact of COVID-19 over the past year on social work practice and our services, and how we've developed as individual practitioners, but also how our organisations have pivoted and adapted to cope with these amazing challenges that we've all been through. And when we talk about Ubuntu as that theme for World Social Work Day, the issue there is around what happens is looking at the situation as a whole, right? So what happens in one part of the world, how that can then impact on the rest of us. And we're only going to get through this as with a global response. So as well as we do in terms of getting vaccinations out in our own country, for example, it's only going to be as good as how we do in terms of getting vaccinations out in low to middle income countries as well and around the world, because this virus is going to potentially mutate in different regions, and we're going to end up with different strains of it. So it's a real reminder really that we need to come together as a humanity really and connect to better serve our societies. So it's as I say, it's really great that we're here to talk about some of these issues on World Social Work Day, and particularly how our services have developed. And our organisation, as we know, has got businesses that run from tech startups to VR companies, right the way through to where we mostly work across this group today around children's services and delivering direct services to children and families that are in need. So at the moment, I think we've got around 1,500 children, for example, across our services that are in foster care placements. And I know colleagues on the call now are going to talk a little bit about how that's impacted in their services over the past year. So we're delivering services from Australia to Finland, right the way through to Japan and Canada, and some colleagues on the call will be from those countries. So I'm really pleased that you've joined us here today, a group of social workers from these services. And I think it'd be great if we can just start with a round of introductions first. So perhaps Bill, you'd like to go first and talk about, introduce yourself and tell us where you're from and what your role is in Key Assets there.
Good morning, everybody, for me, or good evening to some colleagues. My name is Bill Walters. I'm the Director of Clinical and Professional Services with Key Assets. I'm based in St. John's, Newfoundland, which is on the eastern side of Canada.
Thank you, Bill. That's great. Thank you for joining us all the way from Newfoundland. That's great. Thomas, over to you. Could you introduce yourself?
Good day. My name is Thomas Edwardson, and I'm a foster care recruitment officer in Family Help in Norway, and also a foster care consultant over here. So,
great. Thanks, Thomas. And it'd be really interesting to hear about how practice has changed in relation to that foster care recruitment issue as well as we get our discussions going. So yeah, thank you. Elaine, and you're over there in Ireland there.
I am. Good morning, good evening, good afternoon. I'm Elaine O'Byrne. I am a member of the senior management team in Fostering First Ireland. My role is I'm principal social worker, so my remit is oversight of the social work service, children's services, and the therapy service in FFI.
Thanks, Elaine. And Serena, over to you. You're one of our colleagues in the Answer group, right?
Yes, I am. I'm the head of service in the Answer group, and I'm responsible for what we call our direct children's services, which is listening to and promoting the voice and the rights of children with some of our partners. I'm also responsible for the VR, and there's two elements here. We use VR to enable a better understanding and insight into children who've had particularly adverse childhood experiences and how that impacts them through childhood and into adolescence. And we're looking for change of behaviour with the adults we work with. And secondly, we're looking at using VR for connectivity and connecting people through virtual social rooms as well.
That's
but
great,
hello
Serena.
to everybody.
Thank you for joining us. So we can see the image behind you of people with the VR, the VR headsets on. So it'd be interesting to know how that's how you've been able to do that and push that forward during COVID, and whether it's been of use in the situation we've been in over the past year. Thank you, Serena. And Nabe, you're I think you're the latest in the evening. You're late at night, 9 o'clock in Tokyo, Japan.
Yeah, I'm Nabe from Key Asset Japan. I'm the CEO of the Key Asset Japan. We got the 11-year history in Japan, and we provide private independent fostering service in Japan, and we are the pioneer, and we still keep leading our fostering service system in Japan. Thank you for inviting me to join
Thanks,
this.
Nabe.
Thank you.
Thank you for taking the time. And Steve, over to you. You're based in Ireland, but you've got a wider remit, right?
Yeah. Hi, everyone. I'm Steve Jakes, and I'm the Group CEO for Key Assets in Europe. So I'm a social worker, so happy World Social Work Day. And I've been a qualified social worker for 26 years this year. I always look back and remind myself of when I first qualified as a social worker, and I used to be in awe of people who had more than 10 years post-qualifying experience, and used to think that they were just immensely wise and capable. And 26 years on, I realized that they were great blaggers, and they were, good at making it up as they go along. So, So hello, everyone. And I've obviously been involved in developing Key Assets since its inception in 2005, and have been involved in working across all the different countries where Key Assets companies and organizations are represented, from Japan right through to Canada. So it's lovely. And obviously where it was birthed in Ireland in 2005.
That's great. Thanks, Steve. And I think that just in these introductions, it's sort of highlighted how we're sort of uniquely placed to kind of comment on this stuff around World Social Work Day today, right? There's not many global organisations like ours where we can all share these experiences, from one side of the world to the other, and learn by exchanging best practice and our knowledge and skills and experience in how we're working to support children and families. But as I say, today it'd be great to focus in on just how things have developed over the past year. It's been quite a year to reflect on. So if we can have a bit of space now for our discussions to focus in on that, how things have been. So yeah, I'll open it up to whoever wants to kind of go first at this stage to give us a bit of an update on what the COVID pandemic's meant in their country and in their setting, and the impacts of that to start with. So, Thomas, you're unmuted. Do you want to go first?
Oh, I'm not. I will remember to switch it off after.
That's fine.
12th of March last year, Norway closed down. And then we had a meeting on the office, and we said we will not stand down. We have to hold the services open, and the vulnerable children will be hit hard for this virus. So while others have taking a break and looking at the situation, we have used our time to try to open up new camps and new foster care, and we managed that. But it's hard, really hard to work other ways than we normally do.
Yeah, so, and with that, you undertake youth camps as well, right?
Yeah, so we have opened up one youth camp. So we have no 3 camps for hospital care, weekend care in groups for children. And we're really proud of that we had made to open up a new one under the pandemic. And we also gone from 20 children in foster care and up to 28, and we're going for more kids in hospital and foster care in the months that will come also, because the children is still there, and there are more of them now. So,
and with the camps, just to ask Thomas, the camps, so you've managed to bring children together for the camps as well. Was there an opportunity between lockdowns where you got children together for those?
Yeah, we managed to hold them open under the lockdown also, but we have to the kids that need one grown up on 3 kids, they have not so much need as the ones that need one-to-one care. So all the children that was most vulnerable got the camps also under the lockdown, but the children that have not that big problems, they had a little break, but after May they have been to camps all the time. So we have a little we are a little happy in Norway also that the pandemic haven't hit us so hard as other countries. So maybe a little luck also.
Yeah, and what we know about the impact of social isolation on children and young people, and the impact of lockdown on their emotional well-being, you know, for some young people seem to be able to cope with lockdown and the security of that at certain points in time for it. But it does seem like what you've been able to do to bring children together is really important for some children in care as well, because they get that peer support from it as well, right?
Absolutely. And they need this socialization. They often have hard days on school also, and the school has been down. We're now in red situation in all Oslo area and around also. So we see that these kids, they need to be interacting with other kids, and you know, they have these needs to be out with other people. So we cannot just sit down in our caves. The children will give impact on them if we don't let them be out with other people. But of course we have to be very careful about this virus, and take all this responsibility and do whatever we can do to not get any virus on our kids and our foster carers and camps and stuff like that. And the office have been closed down for many months. Only some few people on the office. We are on home office, but we use our time out with the kids, and in the foster care and camps we are out. But all these meetings we can have on Teams and stuff like that, we do, of course. Yeah.
Thanks, Thomas. And Bill, over there in your part of the world in Canada, how have things been there?
Very similar, actually, to the situation that Thomas is describing. We went into our initial lockdown in March of last year, and then that required a kind of a total overhaul of how we viewed programs. And as Thomas mentioned, just because many of the mainstream programs and supports and services shut down, the need didn't shut down. Actually, the need was exaggerated by COVID-19. So then it was, I guess, the task for us to look at how we adapt across our programming areas. And for us, we have, I guess, quite a diverse drop-down menu of programs and supports. So we do family-based care. And I believe right now we have 51 family-based care homes, but we also do staffed arrangements. So we currently have, I believe, 48 kids in staffed arrangements. But then we do a lot of community-based and outreach programs. So for example, through one of our programs, SNAP, we're servicing, I believe right now, 87 families on an outreach basis. We have a clinic where we're doing clinical services, and we have, I think, 98 active individuals or families on the clinical caseload. So when we looked at what public health guidelines were and what the restrictions are, and for us it's level 5, which is complete lockdown, what does that mean then for that full roster of children, youth, moms and dads and families that we're supporting? So we had to get quite creative in looking at how we leverage technology, how we looked at trying to do outreach services, as Thomas mentioned, in a COVID safe way. And then we always had to have a plan A, a plan B, and a plan C, because as everybody is aware, the situation evolved so rapidly and changed on a day-to-day basis. So for example, we came out of lockdown, but then about 4.5 weeks ago, thereabouts, we went completely into lockdown again because a variant got introduced here on the island, and widespread community transmission. So if you look at, we've been fortunate as well because of the public health measures here. So we only have slightly over 1,000 cases in total. But when the variant got introduced 5 weeks ago, 400 and something new cases emerged in less than a week. And for us, that's pretty scary if you look at our demographic and our reality here. So for us, it's really been looking at, what does the community need? How do we work in collaboration with our community stakeholders and partners? How can we leverage the expertise and insights we have, but also how do we get very creative and very resourceful in making sure we're still trying to, in some topical way, meet the needs of those families the best we can. And that's definitely been quite the adventure for us, as I'm sure it's been the case for others on the call.
Thanks, Brian. That's really interesting. I'm sure others will echo some of those experiences as well. Elaine, how's things been in over in Ireland?
Yeah, similar, Justin, in that sort of, having to continually rethink and reevaluate where we're at, and that kind of ongoing process of kind of taking the temperature, where we are at in terms of public health guidance, restrictions, lockdowns. I think, the main pieces for us really, initially when we went into lockdown last March was to look at the carer pipeline in terms of, keeping it moving, keeping a focus on recruitment. How are we going to do that? How are we going to manage that in terms of restrictions and being limited and being able to meet with people face to face. So, a lot of our, initial contact with potential carers has been obviously focused online. I think one of the advantages for us was that we have a good online presence, and it's something that we've been working on consistently before we went into lockdown. So positioned as well to manage those kind of initial interfaces with potential carers and applicants. So we've had to look at things like, moving visiting carers into online forums. The team have got really creative in how they've managed that and how they've responded to that. And, we've kept a good sort of strong pipeline of carers coming through. Obviously, the other challenges have been around how do we continue to support and oversee and supervise placements for kids in the same way. And again, that's been a combination of, assessing risks and safety and visiting where we can and moving online and doing what we can online. And, again, that's been a continual evaluation of what's working, what's not working, how do we move it, how do we shift it, how do we make the best use of that space to ensure that people still have that connection with us and are still supported. So again, the team have been amazing in looking at creative ways of doing that, from running our carer groups to online to doing a lot more joint work actually, which I think is something that I've seen come through, is actually we're a lot more accessible in many ways. So we can partner up with the child social worker and do joint pieces of work. We can get our therapists involved more easily, and they've been far more accessible to staff and to carers because we've used the technology in the best way that we can. So yeah, I think overall, for me, I think a lot of the how we've reacted and responded is just hinged on staff and their openness and creativity and resilience and flexibility to be able to reshape what we're doing. Yeah.
And that's fascinating, Elaine, what you were saying there about the joint work. And it's not, it's something that I've taken for granted, I guess, but if you look back now at the amount of meetings that we were able to kind of pull together with people from different organizations, and in my role with colleagues across the world as well, it's yeah, I wonder pre-COVID if it would have been quite as straightforward. You know, a Skype call or a Teams call was a bit of a novelty, wasn't it? For me in my working life, you know, but now
and that's it. And I think it's been one of the challenges. I'm sure it's the same for others in terms of being a national service and trying to, you know, the challenges of time and travel and getting that, you know, people being accessible. And you know, we've found actually the pace of work has increased greatly, and that we're able to have a meeting, we're able to schedule it, we're all able to get together much more easily. And I mean, I think that, you know, the biggest thing for me is just seeing how people have run with that and have been able to work jointly in a way that would have taken maybe weeks to organise. You know, we can get a meeting done tomorrow, or you know, a session or a support session with a carer or whatever. So yeah,
it'd be interesting to hear people's reflections as well around you know, looking after staff in that environment as well. I know some of you are supervising staff as well, because I think, you know, from my experience, like people's workloads have you know, become quite intense as a result of some of this stuff, because it is that much easier to fill your day up back to back with meetings, and there's no space between those meetings to go and visit from one location, you know, drive from one location to another, or even walk from a meeting room to another meeting room. And the intensity of it is something to be mindful of for looking after staff as well, I think, right?
Yeah, I've heard that from a lot of staff, you know, a lot of staff who didn't really appreciate the reflection time and the, you know, the car journeys gave us, you know, or the kind of processing time just to think things through and move from one space into another space. And I think you're right. I think we've had to be really cognizant of that in terms of the pace of work. I think there was an initial perception that we're all at our desks, we're available, you know, we'll get through things, but actually, you know, just being able to kind of plan and structure your time has been something we've had to look at and develop over the last year, and trying to manage that a bit better. I think staff well-being has been a huge thing, and I think something that we've had to be really cognizant of, that we, you know, we're not all coming into work and dealing with a pandemic. You know, we're dealing with a pandemic in our lives, you know, all of us, and you know, how that's played out for people, I think has been really important to, you know, to keep to check in on that, I think, and be really aware of that.
Bill, I see you nodding vigorously up there. You agree with that point, right?
Completely. And I think even as social work practitioners, to bring that back a level, I think that's one thing that makes the pandemic truly unique in many ways. And that I think we're trained, you know, in social work school around vicarious trauma and compassion fatigue and transference and countertransference and all those other big words. But it's usually us looking at our helping role in relation to the other. But as Elaine just mentioned, we're all in this together. Every day we need to be doing checks and balances on ourselves, our wellness needs, how we're managing, how we're coping, what are our concerns and anxieties for our loved ones today. And then we have to put on our hat and interface in a helping role where we're helping others walk that journey as well, be that our carers, be that our staff persons. And I think that makes it a truly unique, and it fits very well with the I am because we are theme. We truly are all in this together. And, you know, there's the cliche, you know, same storm, different boats, and fully acknowledging people are in very different boats out there, but we are all definitely in the same storm. And as helpers, we need to be so attuned to that. And how are we impacted on a day-to-day basis? And what does that mean in how we go about supporting others, our relationships with others? Because I think if we're not having our finger on the pulse of how we're managing this situation, how we're being impacted with this situation, how we're self-caring in this situation, we're not the best tool to support other people. And I think as practitioners, that's something that's truly unique about the situation we're all in together at this very moment.
And in the, you know, the UK, the numbers have been astronomical in lots of ways, and it just and for most people now, there's somebody that you know that's experienced it firsthand. You know, whether that's about loss or, you know, the impact of people in your networks that are there, or just the increased threat of it as well, that there's the increased risk of that you're putting yourself at when you go to a grocery store. It has an impact, you know, it really does. And you tie that with the emotional nature of our work and the emotional labour that we take on as social workers. That self-care bit is just so vitally important. Yeah, thank you. Put that very well, thank you. Serena, over to you. How are you doing in answer?
Well, I think COVID's been, well, for everybody, it's been a very interesting journey. I think around England, obviously, we've been in quite in and out of lockdown over the last year. I think it's had a huge impact on our just communities. I think children not being in school for lengths of time. I think, as you say, I think for the workforce, you know, we're not just managing ourselves, are we? Lots of people also, they're schooling while they're at home, they're managing their partners while they're at home. You know, it isn't just you and your work, it is you and your whole community in your house. I think the level of need is for the children that we talk about has increased. I think a great concern in England is the fact that lots of this is currently hidden because we're not seeing the children, we don't know what's going on. Although children have been encouraged to go to school if they need to, I'm sure the children who we really want to see aren't going in. But for the service areas I'm involved in, some of the nicer bits, the innovation, the opportunities that workers have taken is around like art participation, advocacy and independent visitor services, where people have taken it, these people have contact with the children to hear their voices, to befriend, to advocate, and people, we seem to have seamlessly, maybe not quite seamlessly, moved online, but we've got lots of contact online, we've got people holding monthly sessions with children, doing cooking online, playing games online, playing bingo online, and just continuing relationships, which I think is really, really important that these relationships are maintained. Within the my virtual reality world, it's also been quite interesting. Fundamentally, we engage with partners and we do training. I have to say, as a team, we do seem to have seamlessly moved online with this, and I think there's great benefits on this. The challenges have been around using the VR because people aren't keen to use VR headsets, and it has been impractical. And we've looked at using our content in 2D. And I think for us, the work that we have done over the last year is also looking at how we are going to really help people move beyond COVID and what we can offer. And I do think with the VR, it's looking at, you know, the accelerated learning, behaviour change. Just prior to COVID coming in, we've done some research with one of our partners and Goldsmiths University about using the VR with people, domestic abuse perpetrators. We've had some really, really, really positive outcomes from that. Unfortunately, COVID did get in the way, but we are just about to engage with more partners to do some more research. And that thing is, you know, some really powerful statements from the men who saw this. You know, I'm going to change my behaviour. I didn't realise it impacted the children. Tearful, emotional engagement. And the men who were involved in that study, 9 months after, nobody in the family had been re-referred for a domestic abuse incident to the police, which we think is really powerful and a really strong message to go forward. So we really want to engage with people looking forward and what technological tools we can help people with. And hope, you know, I think we can't look backwards. It's really about looking forwards and what we can put in to support people. But I do think it's a huge challenge. And I think if you read the newspapers in England, we're talking about resource cuts in our local authorities. So they are really going to be prioritising the services that they have and looking for what is going to make a difference to them.
Yeah, and your services with the VR stuff, as the research sort of suggests there as well, it's a really immersive, powerful experience for people to build their empathy and put them in somebody else's shoes, right, in different settings. And I know some of the fostering services have used it as well for training foster carers as well. So it's really interesting.
Yeah, we're really proud. We're working with our colleagues in Canada, Ireland, Finland, New Zealand, Australia, and I think we've had some really, really positive feedback from our partners there. But generally, what I'm always proud of is when we do introduce the VR, and we tend to train professionals, majority of social workers, say family support workers, teachers. we tend to get 90% of the people who see the content say that they personally have a greater insight into the child's perspective and understand the child's world. And for me, that is just huge. I felt like that when I saw it. It really did. I thought, my gosh, this changes. This would have changed decisions maybe I've made in the past, and it would definitely influence and impact me in my thinking around working with children and the decisions and conversations that we have with them. So I do think it's a really powerful tool.
Elaine, did you have a point on that?
We've done the training in VR, and we have it here. We've been trialing it and at different points and sort of looking at how we'll implement it and how we'll use it going forward. I think, obviously, as Serena said, there's been challenges in that in terms of not being able to get together face to face. We've in pockets, when we've come out of restrictions, we've been able to use it and trial it with applicants and with some of our existing foster carers. I think the thing about it that it represents for me really over the last year is that bit about holding people in some kind of space of thinking forward and looking at the potential for that. And I think it's been energizing actually to stop and to spend some time thinking about VR and how we'll use it and how we'll implement it. There's loads of potential for it. We've had really good feedback from carers and from staff who've experienced using it. So yeah, really exciting for the future, and and lots of ideas floating around that we'll share with you, Serena, about how we could develop it and go forward with it. So
yeah,
thank you.
Well, we're really excited that we can share other people's knowledge and how they use it. And one of our partners, they actually used it using the 2D. And in the last 2 months, they've started using it in the last 2 months, and they've already had some really positive feedback from their foster carer panels, their prospective foster carers. And it's just a really motivated team of professionals who are willing to look at innovative ways to work and to embrace it. And I think that's what we all want and need at the minute.
Yeah, and I know our colleagues in Foster Talk are using it as well, Serena, aren't they, and developing some training using it as well. And I saw a really fascinating example of it where they were undertaking a child's placement through the eyes of the child, and where you can really put yourself in a child's situation from the moment that they get into the car with their social worker, they're driven to a new placement with the social worker and the foster carer having a conversation about placement forms and review meetings and contact details. But you see it from the child's experience, and with birth family, other birth children coming into the room and getting to know people and seeing the house and all those things. It's a really immersive experience that I think when we talk about kind of trauma-informed care as well, and we're talking about understanding that kind of emotion in all of that, and how to regulate those emotions in certain scenarios and try to really build that empathy. Those tools have got real potential to support with that work as well, I think. That's great. Thank you, Serena. Thank you for joining us. And Nabe, we'll go to you, and then we'll finish. We won't finish with you today, but we'll get on to Steve after Nabe, if that's all right, because you've got a bit of a broader view across a few countries, haven't you? So Nabe, can you give us some thoughts on what you've heard so far and maybe the situation in Japan?
Well, it's quite difficult to say. I mean, of course, when I look back the last 12 months, we got a lot of the impact, and the Kia Japan got some damages from the COVID-19. But I'm not still sure if I could say it's pandemic here in Japan. The situation is quite different from the other European countries or North American countries. No one knows the particular, exact reason, but the Japanese society has historically, and probably culturally as well, tended to require the people to be, what can I say, obedient to society. So even though people are not, legally locked down, they still refrain from the going out or people always strictly get the face masks, and they washing hands, and they also everything person, they pushing each other to wash hands, and they wearing mask, and they, as a result of this, we got small number of uh, the people who got infected with COVID-19. But on the other hand, the Japanese economy is almost dead because social activity has just stagnated, and there are no visitors for business or tourism from overseas. It strikes our economy, and you know because of this trend, who got the damage? Of course, the women and children. Uh, you know, uh, the Japanese society, it's quite strict, and many people committing suicide every single day. But this year, last 12 months, the female, people, if ladies committed suicide, the number is how many? Maybe more than 40 or 50% higher than regular years, because the regular income, average income of ladies, female workers, is just 60% of male workers. So the gender issue is very huge, and it means the COVID-19 economy depression, the damage strikes the weakest, children and ladies. And we haven't seen the clear evidence that or like numbers increasing in child abuse or family separation or something yet, but we don't know what's happening right now. And the children in placement also got some impact. For example, particularly the children in process of family unification, um, especially children placed into residential care. The residential care this country is quite different from residential care you imagine in your country. 40 or 50 children living together. So the parents, they, during the COVID-19, infection, and also restricted the society, they sometimes try to visit their children in residential care. Um, they can't because of the because of the COVID-19. They can't visit their children, so it means the family unification program, the totally stacked. So that kind of impact children already got. Um, but to be honest, the Kia Japan, we got the economic, financial difficulties, but when I look at the social workers practice, they improved a lot. We didn't use much SNS or like a latest technology, um, website or remote meeting or those things. We didn't use that one. We are not good at. But the last 10 months we developed a lot, and many social workers now, they remotely visit families or remotely assess their prospect foster carers, and the prospect, especially prospect foster carers, are very happy to welcome our remote visit or assessment or meeting and training. And now we got we can find some line, what kind of service we have to directly provide, what kind of service we can provide remotely. And that's the really good outcomes we can find. And our social workers, they and also recruitment coordinators, they work really hard, and they know we are in crisis. That's why we worked so hard, and we changed the mind. We are not dying, we are in crisis. It means we have to show the better outcomes more than average years. So unfortunately, the outcomes is almost same as average years, but it shows the just highlight, comparing other agencies, we show really good outcomes for children and the society. um, so I'm really proud of my team and my social workers and the recruitment coordinators as well.
That's great, Nabi. Thank you for that. And it'll be interesting to, we're going to run short of time. It's always the way, isn't it, with these things? But it'll be interesting to hear a bit more from other people as well around the issue of how you undertake those assessments with foster carers. How do you do that, balancing out really getting to know them as a family, getting to know them as a safe placement for the children as well, and that element of the safeguarding aspect of it. How can they for what they're doing in their practice as well? How do you build up their knowledge and skills? How do you balance that out with safeguarding and do that online, do it virtually?
Yeah, everybody, yeah, in my society, probably, your society also same, but everybody knows that our, actions or business or activities are totally, restricted. We can't get freedom. We can't go everywhere. Any time and space and our activities are all limited. And foster carers or candidates also know that, but under the restriction, we showed how we try to contact as much as we could, more than usual situation. It means they understood how much they are valued from our point of view. So it means they now more understand how we see them, how important they are for us. So it's really good sign.
Yeah, they're your key assets, right, Nabi? To bring that back
Yeah.
in. Yeah, those foster carers are at the centre
Yeah.
of it all, right? That's that, no doubt about it. Yeah, yeah, really interesting reflections. Thank you, Nabi. Steve, you've listened to lots of people now. Then, so you're one of the last ones to go here. But what are your thoughts on the conversations you've had so far and observations?
One of the things that I was thinking about as I was listening to everybody is just how incredibly adaptable social work professionals are around the world. And the theme that kind of went through from Thomas to Bill to Elaine to Serena and Nabi and yourself, Justin, is that, people adapted and changed their practice. They challenged themselves about how to do things differently, and what they didn't do, though, was take their eye off the ball when it came to meeting the needs of children and young people. And I think there's nothing like a crisis to send us all into self-preservation mode. How can we protect ourselves? But one of the things that struck me as I was listening to everybody was just how people stayed focused on continuing to recruit foster carers to make sure that we could still offer safe homes and places for children and young people, highlighting the impact of domestic and family violence so that the message didn't go away, that where we're offering clinical services and family support services, that we can do that without jeopardizing people's vulnerabilities, and making sure that they're still at the center of what we do. And even listening to Thomas talk about the camps and the fact that they were still able to deliver group-based activity, and the camps in Norway provide therapeutic support for children and young people, and that they were able to continue to do that. And Nabi talking about Nabi talking about basically being able to adapt to more remote types of support services, etc. And it reminded me when we first, back in March 2020, as a senior manager of an international social services organization, I was literally caught in the headlights. I have not, been in a situation where I have to deal with a global pandemic. You know, we have business continuity plans and all those things in place, but obviously this just caught me off guard because the world locked down very quickly. And one of our incredible social workers in Finland, very early on in the piece, said to me that this is a crisis, we're the crisis people, and we can do this. And I remember thinking, she's right, and we've got this. And so we moved very quickly to distribute our workforce around the world to, you know, we fortunately had digital platforms that we could move on to fairly quickly. But in essence, focusing primarily on making sure that we keep our children and young people, our foster carers, the families that we support, our clients in the community, central to our decision making. And I think one of the things I've been really inspired by with social work across the world is that government and non-government, whilst initially behaving like rabbits in the headlights, as we all did, suddenly very quickly came together to find solutions to how we can keep children safe at home, you know, how we can continue to assess foster carers virtually and present those assessment reports to panel with very limited face-to-face interaction, if hardly any at all. And I think that you know, early on in the piece, when we were sort of planning and thinking about how we're going to manage this, there were three messages that or three key themes that I wanted to impart to the people that I have responsibility for, the majority of whom are social workers, was that we take an Alice in Wonderland, a Wizard of Oz approach to this, which is that we apply the principles of courage, compassion, and intelligence to the way that we you know, continue to manage and oversee our services. And that was a message I sent out to all of our teams, probably around April, May time, as we started to kind of adjust to this. And one of the things that I was really impressed with was the way that our social work community around the world came together and developed new policy frameworks, developed new assessment tools, moved training online, and shared experience and knowledge to be able to put in place processes that kept people safe, but kept children safe as well, kept families supported, you know. And I think, you know, when Serena was talking about things like the VR stuff around family violence, you know, one of the scariest things for me about lockdown was that how vulnerable children and women, like Nabi said, and vulnerable people in general, whether it's mental health or, you know, this lockdown and this pandemic exacerbated all of those issues. And so whilst it was right that frontline healthcare staff, nurses, doctors, and all those champion people who have been keeping our world ticking over from a health perspective, I saw social workers continuing to transform people's lives and, more importantly, keeping children and families safe. And, you know, day in and day out, they were on the front line. And, you know, on World Social Work Day, it's incumbent on us to recognize that as well. So just listening to people, even in their little anecdotal stories of what happened around the world, you know, I was privileged or fortunate in my position to have this kind of global perspective of what was going on. And, you know, as a social worker, I guess I'm biased, but I have just been in awe of the way that people have challenged themselves about practicing. You know, for example, we can't assess foster carers without seeing them in their home on 6 to 8 visits. To challenge their thinking at the end of the day, there are vulnerable children out there who still need placements during this period. We can't stop the process. And like Thomas said, you know, in some situations, people did stop because they didn't know how to move forward. And that was a risk for our, you know, for vulnerable children and families. We couldn't afford to stop, and we didn't.
Thanks, Steve. You've really rounded it off nicely from everybody's contributions as well. So it's been, you know, fantastic being a part of the foundation and meeting with the CEOs in particular over the past year, where that exchange of practice is you know, has just been so evident. And as you say, when when we first went into lockdown, the sharing amongst the CEO group with their policies and procedures. I know, Nabi, that you were meeting with Wayne, for example, from New Zealand, talking about, you know, remote working policies, getting all of those things in and sharing them across the piece. It was really great to see. And then beyond that, as I say, these communities of practice that we've built as well, I think are really a great way forward for us as a group to build on that interconnected bit, going back to that Ubuntu bit, you know, that I am because we are, we are all connected in this network, and we can definitely benefit from each other's knowledge and experiences, and hearing you share those things today will resonate. You know, your experiences resonate as a group, but I'm sure when we share this with our wider colleagues, they'll be really interested and fascinated to hear about how things have developed in different parts of the world over this past year. So it just leaves me to say thank you all very much for participating today and giving up your time. I know you're all very, very busy people. And yes, happy World Social Work Day to everybody. So thank you.